I'm Dr. Vaishnavi. Can I know your name, please?
Manal.
Okay. Manal, today I am going to have cranial nerve examination on you. Shall we proceed?
Yeah, sure.
Thank you. Now, we are going to test olfactory nerve. In this test, first ask the patient to close the eyes. Can you please close your eyes? Then ask the patient to smell a substance. Can you please smell it?
Yeah.
Can you please recognize it?
It's coffee.
Yeah. Again.
Onion.
Fine. There are some tests to check your visual acuity, and there are some tests to check any problems in your eyes. The visual acuity test. In visual acuity test, I will ask the patient to sit 20 feet apart from the Snellen's chart, and I will ask her to read the letters from top of the chart to the end which she can read the smallest line. Okay, by that I can assess her visual acuity. So Fiza, now I will ask you to hold this card and close one of your eye and read the letters till the line till which you can read the smallest line. Okay.
E F
Okay.
P
Okay.
T O Z
Okay.
L P E D F E L O P Z D.
Okay. Can you please change the card to another eye? And now,
E F P T O Z L P E D T O L O Z P D.
okay, fine. So, now the patient could read the line of visual acuity 20 by 25. So, it means the visual acuity of the patient is 20-25. 20-25 means the 20 is the distance from which the patient is sitting from the Snellen chart, and 25 is the distance from which a normal eye can see. Okay, so Fiza, by this we can say your visual acuity is 20 by 25. Okay. We are going to do tests for checking lesions in anterior and posterior visual pathways. So there are two tests: static finger wiggle test and kinetic red target test. So first I am going to do static finger wiggle test. In this test, I will ask the patient to look into my eyes. And now I imagine a glass jar around the patient with base facing towards me. So I will ask the patient to look into my eyes. Fiza, can you please look into my eyes? Straight. Okay. Now place the fingers lateral to the ears and move fingers around the boundary of the jar. And now I will ask the patient to say when first she could find my finger wiggling. So, Fiza, can you say when you see my finger is wiggling? Yeah. Okay. Where? Okay. Now from your right eye. Yeah. Thank you. And, now we are going to test the pupillary reaction towards light. Now, first I will ask the patient to see straight, and I will flash the light obliquely. So when I flash the light obliquely onto the eye, pupil should not constrict. Now check for the direct reaction of the pupil towards the eyes, and then quickly sync the light to see the consensual reaction of opposite eye. Now going to check the extraocular alignment. So, Fiza, I will project this light directly onto the bridge of your nose. So you should look towards the light. Look towards the light, please. So when you do this, please observe the reflection of light should be in the center of the pupil, directing nasally. Now going to do the fundoscopic examination. For this, first darken the room. Now set your ophthalmoscope to 0 diopters, then adjust your light. Now we are going to test the patient. Now ask the patient to look at a point straight on the wall. So Fiza, please look straight onto the wall at a point. Now if you are going to check the right eye of the patient, use your right eye and your right hand. Hold the ophthalmoscope in your right hand. So now from 15 inch apart and 20 degrees lateral to the patient's line of vision, focus the light onto the pupil. So you may take help of your left hand to make you steady. Now you make sure you see clearly through the aperture and find for the red reflex which appears in a orange color. When you locate the red reflex, hold that red reflex and move closer till you reach your thumb of the left hand. Now look for the optic disc. Now we are going to examine cranial nerve 3, 4 and 6. First, check the gaze of the patient. Then go to saccade reflexes. First, check the gaze and ask the patient to follow your finger. Can you please follow my finger? Fine. Now we are going to test for saccades. Now just look at my nose and my hand wiggling. And this side. Now we are going to do violational saccades. Can you please look all the way to the right? Then look at me. All the way to the left. Then look at me. Look down. Then look at me. Fine. Now I am going to do oculocephalic maneuver, also called doll's eye maneuver. In this, ask the patient to look at you. Can you please look at me, at my nose? And then hold the head of the patient, move towards the right, move towards left, and then down. In this, observe that normal patients will not have any eye movement, but the comatose patients will have involuntary eye movement. Now we are going to test the trigeminal nerve. Trigeminal nerve will have 3 branches: ophthalmic, maxillary and mandibular branches. First, test the sensory functions of the nerve and then go to the motor functions. In sensory functions, first check for the light touch. Take a cotton swab and rub on the patient's face slightly and ask the patient, do they feel that? Are you feeling this?
Yeah.
On both sides?
Yeah.
Now do the pinprick test to test the sensory function of the nerve. Are you feeling this?
Yeah.
Check on the both sides.
Yeah.
Now check for the corneal reflex. With a tissue, slightly touch the cornea of the patient. The patient should blink his eye if there is an intact cranial nerve 5. Now we are going to test for the motor function of cranial nerve 5. First check the temporalis, then masseter. Ask the patient to clench the mouth. Can you please clench your teeth? Again. Can you please open your mouth? Don't let me close it. Now we are going to inspect the facial nerve. First, in examination of the facial nerve, first inspect the face, check any atrophy, muscle weakness And check for the facial expressions. Can you please smile? To check the tone, ask the patient to raise the eyebrows. Can you please raise your eyebrows? Can you please close your eyes tightly? Once again, don't let me open. Okay. Puff your cheeks. Clench your teeth. Fine. Now we are going to examine vestibulocochlear now. First, ask the patient, is she able to hear the soft sound? Are you able to hear?
Yes.
Then perform Rene and Weber test. Take the tuning fork, vibrate it and place on the head of the patient. Ask the patient, do they feel same sound on the both ears or sound localized to one ear? Do you feel same vibration on both ears?
Yeah.
Fine. Now I am going to do Weber test. Vibrate the tuning fork and keep on the head of the patient and ask the patient, do they hear the same equal sound on the both ears or sound lateralized to only single ear? Are you able to hear same sound on both sides?
Yes.
Fine. Now perform the Rene test. In this test, vibrate the tuning fork, keep on the bone, then keep immediately beside the ear and ask the patient, do they able to hear the sound? Are you able to hear the sound?
Yes.
Now we are going to check the vestibular function. Ask the patient to look at you, then move head jerkingly towards right and left side. If the patient having problem in vestibular now, then they feel dizzy. If the patient is normal, the gaze will not move any side. Now we are going to test the vestibular branch, the Dix-Hallpike maneuver. In this test, just move the head quickly, hanging in supine position towards the lateral side. Now we are going to examine the cranial nerve 9 and 10. In this, first inspect the symmetry and elevation of uvula. Can you please open your mouth? Say ah. Open your mouth wider. Check for the symmetry and elevation of the soft palate and uvula. Now check for the gag reflex. Ask the patient to open the mouth. Can you please open the mouth and slightly stick your tongue out. Touch the posterior side at the pharynx. Now we are going to examine the cranial nerve 11. In this, first check the sternocleidomastoid muscle. Then ask the patient to turn head on one side. Then apply the force and ask the patient to resist the force of your hand. Then check for the sternocleidomastoid function. Thank you. Now ask the patient to shrug the shoulders against the resistance of your hand. Fine. Now we are going to examine the cranial nerve 12. In this, ask the patient to stick the tongue out. Can you please stick your tongue out wider and check for any fasciculations, asymmetry of the tongue. Ask the patient to move the tongue side to side. Can you please move your tongue from one side to another side? Okay. Can you please hold your tongue in cheeks and press against my fingers? This side. Fine.